Get ready with me as I talk about membrane sweeping, also called getting your membrane stripped. I am Dr. Allie. I'm a board certified OBGYN. I just realized I don't think I told you guys I'm board certified. So sidebar, this past year, 2022, I studied literally for 8 months, maybe more. Honestly, it was like a year-long process to take my oral board exams. I collected cases and I passed my oral boards. So I'm done with exams and your girl is board certified. If you follow me over on the camera app, then you know that I treated myself to a new bag once I found out that I was board certified. So make sure you're following me on there. But let's talk about membrane sweeping. So if you're pregnant, this is a method that we can use to help kickstart spontaneous labor. Now this is optional. So I offer it to my patients if it's safe and something that they can do. And I do it when they're full term and I have a discussion with them. I explain to them exactly what is being done. So let me explain it. No one should ever force you to do this. You can always decline. So essentially what you're doing during a membrane sweep is separating the bag of water that the baby's in from the cervix. So, Dr. Allie, how the heck do you do that? Let me explain. Also, I'm not a dermatologist, but I started using this, Paula's Choice 1% retinol treatment. I feel like my skin looks I just have sunscreen on and then this powder. Love it. Okay, so when you're 1 centimeter dilated, if I make a fist like this, picture this as a cervix because the cervix is a little circle with a hole and a dimple in the middle. When you're closed, I can't get a finger through your cervix. When you are 1 centimeter dilated, I can comfortably place one finger through your cervix. So you have to be at least 1 centimeter to have a membrane sweep done. So with one finger inside of the cervix, I gently sweep around the cervix and separate that bag of water from the cervix. This releases prostaglandins and phospholipase A2 that help soften the cervix, help kind of kickstart labor a little bit. And it has been researched that it can make or kickstart spontaneous labor within 48 hours of having this done. So it may or may not work. If it doesn't, then you just stay pregnant. And if it does, you may go into labor all on your own within 48 hours, which is pretty cool. What are the risks and downside of this? One, it's not that comfortable. If you've had your cervix checked, you know it's not like, oh my God, this feels great. So it is pretty uncomfortable. It can be crampy and it may lead to contractions. And it is normal to have a little bit of vaginal spotting or vaginal bleeding after this, because anytime you mess with the cervix in pregnancy, similarly, when you have sex in your cervix blades, it's like that. I could talk more about this, but I'm running out of time, but I hope that made sense. Have a good day.